Howdy, healthcare people. You're listening to the Analytical IQ podcast. I'm Adam Lorton. Today, Lisa Miller from Vie Healthcare has joined me. She's the CEO of Vie Healthcare, a hospital margin improvement consultant, and she's the host of the Healthcare Leadership Experience podcast, a podcast that has great taste in guests. Lisa, welcome to the show.
Thank you, Adam. It's great being on your show. I'm excited.
I wanted to start by asking you, you have been doing cost accounting, cost reduction, margin improvement work for over 20 years. And for most people, cost accounting is not quite like video games where you've loved it since you were a kid and always wanted to pursue a career in it. So can you tell me about where did you turn the corner from, I guess I'm a cost accountant and pretty good at it, to this is something I could spend a career doing?
Yeah, it's a great question. And so I started my career actually on the other side of healthcare. I was a hospital representative in the OR, and I was in surgeries and cases, teaching and about my equipment or my company's equipment and supporting different cases. And I fell in love with healthcare, right? I loved it, and it wasn't. It's hard to explain, but I knew I was in the right field. I loved being in the environment. I had so much respect for the physicians, the nurses, and the team, and everybody who worked in the hospital. I just loved it. And so, being in the OR in particular, you got to see a couple of things. One, the pricing could vary from one hospital to another, right? There was just so much pricing variability. And two, there was waste. There's a certain amount of waste that goes on. And I just kept on, that was a recurring theme. And I just kept on thinking about this great opportunity for hospitals to reduce costs and improve efficiencies. And my background really, although I was in healthcare sales and marketing, was also finance, right? So that was in the background. So I'm going to tell this one story, and then we'll go on to the love of cost accounting, as you say. But I went to one of my department directors, and I said, I think you can pay X for that item. And I remember to this day, 2 weeks later, came back, and she's like, "We got that price. You saved the hospital over $200,000 at one item." And I thought, okay, I think I'm on to something, right?
A star is born.
Yeah. So, from there, there was a couple of years in between there, of course. But, what started with the focus on the OR, Adam, and the focus on the pricing in the OR really grew, and there was iterations to deep contract reviews, cost accounting, looking at utilization, tying cost to reimbursement. I mean, your background is all in, reimbursement on that side, and there's quite a bit of cost that map to the reimbursement. So, as you know, there's so much learning that goes on every single day with the regulation changes and new contracts. So we just had this love of accounting, of finance, and of diving really, really into the details of the contract. And, really, like you said, wanting to make a lifetime career out of it.
Well, and I could imagine that your experience would have a lot of parallels with mine, where being in the data business, a lot of people I work with in healthcare alongside them, they're so thankful to have someone by their side who has a completely different skill set from theirs. They're just so glad, I'm glad this is easy for you because it's hard for me. And so data work feels like magic to some people in healthcare, and I could imagine that your work it has a similar feel, where they're just so glad that there's somebody who enjoys that kind of work because it's not what they would love to focus on.
Yeah, we hear that a lot, and going through the numbers and looking at it in our lens and putting it together and finding the opportunities, we hear that a lot, and it's really it's a nice partnership and alignment when we can work with the physicians and the clinicians and give them those insights. But boy, are they very appreciative to say, I wouldn't have looked at it that way. I wouldn't have gone into that much detail, or the fact is, you guys are the experts. You should be doing that work. You know, someone's often said, if you've got to go to the number one, you have a heart problem, you want to go to the top cardiologist. And so, in some ways, like they are relieved to say, okay, I'm so glad we've got you to look at those numbers or to think that way or to help negotiate with us. So.
Well, I appreciate your sharing that, and it sounds like your work is well appreciated among the hospitals you've worked with. I heard in the introduction to your podcast over $700 million of savings in 20 years, and that's non-labor cost. I appreciate that you. So, why do you focus so hard on non-labor cost, or why is that important to you?
Yeah, it's important because and then now as a company, we never want to focus on labor. It's just, granted, I know that there's opportunities, and I'm not saying that there's not, but that's just not where my heart is, and that's not where our company's heart is. We just know that there's so many opportunities in supplies, services, and processes that we could work for years and uncover those way before. I think many times you look at labor, although I understand why there needs to be that look, but that's just, it's not the work that would make me excited and happy. It's just, I want to do the work I love. And so we have said, we will look at every single aspect of a non-labor expense, which we do. And that's our focus. And I want to tell you one story, if you don't mind.
Please.
During this last year, with COVID, we had a fewer smaller hospitals actually we were working with, and one hospital actually wrote us a really great letter. But the point of it was they got really hit hard financially. A standalone independent community hospital got hit really hard in COVID, and we were able together to save $2 million. And the CFO went right to his calculator and calculated how many jobs that they were able to protect and save. And that's the side I want to be on, is protecting and saving jobs. So.
Oh, that's great. And it reminds me actually, there's I won't name this person by name because I didn't get permission to share this story, but I was emailing with a former health group CEO, and he writes a lot about the promise of lean in healthcare and the promise of continuous improvement. And I wrote to him with a little bit of, I was a little strident about, I feel like we're not seeing gains fast enough in unproductive professionals, and especially, in the executive suite who aren't carrying their weight. And I feel like we should have seen lean reduce those positions. And he very appropriately, he said, Adam, that is not what it's about. Lean is about, continuous improvement is about reducing waste so that people can spend more of their time focusing on high value activities. It's not so we can cut people. And I was appropriately chastened by that. And I really have been eager to reorient ever since that email exchange.
No, that's a really interesting way that he said that. Now they can perform more strategic and perform even more, give more value to the hospital. It's a nice perspective. I wouldn't have thought of it that way either, actually. So you taught me today.
He was right. Lisa, I wanted to jump to an item I was reviewing from Vie Healthcare, 15 effective cost-saving strategies, and there were 3 actually that I really wanted to go into more detail on because, well, they caught my attention. So one of the items on the list of your recommendations for cost-saving strategies is a disciplined spend analytics review. So perform a monthly line item spend analysis. You can imagine why this one caught my attention. And as a data person, I can tell you, we don't like making dashboards or reports that nobody's going to use. So what's your opinion on what's the key to getting people engaged in that review process? Because I could imagine that being the sort of thing that's really exciting the first month and then maybe a little less so in month 7.
Yeah, no, it's a great question. And I will tell you that dashboards and analytics and all the tools, as you know, don't matter unless they're used. So having a great new fancy dashboard is not what we propose by any means, right? You can be as elaborate or use Excel, right? But the key to that point is, I really believe that on a department level, whether we're supply chain and finance, but ultimately there are contracts, there are things that are used, supplies, services, and the more a hospital can get used to looking at real time, right? Real time being in a monthly spend, and they get into that habit. It doesn't have to be for hours, doesn't have to be, it doesn't have to be this big process. It takes time. You could narrow down looking at 3 to 5 important KPIs, but if you're looking at data in real time, we'll call it in a month real time, you're going to capture opportunities, right? You're going to see where those trends may be going. You're going to catch maybe, wait, something's wrong there. Whether we're not billed right or what's going on here. We got to go back and handle that, versus waiting a year, 2 years, and then now having this big initiative that's got to fix it, or say, wow, look at that lost linen rate for the last 11 months. We lost $3 million on that lost linen, versus the first month saying, wait a minute, something's up. Let's go take a walk through. So I know it's a lot it's a shift, but we just think it's so important, is to create that view, and it's got to be a line item view, not an aggregate view. I get very upset when I see so much aggregate data and it doesn't tell you anything. And so how do you get people engaged? I think there has to be a framework that's got to be created, right? Maybe that's the heavy lift. So you create the framework, but other than that, you got to make it easy. And I like ownership. I was talking to somebody the other day. Ownership better than accountability, right? There's just got this ownership about the reviews. But I think if you put the framework, make it easy, and really showing people why it matters to the organizations. I'll tell you, they get a couple of wins and see the value. It's going to take off. They're just going to feel that success. But they've got to be able to put that into their monthly processes or responsibilities, and it's going to pay off big dividends.
Sure. And it reminds me that good meetings are good and bad meetings are bad. So if if the report can be clean, can focus so it's what I'm hearing is keep it focused, keep the meeting tight and disciplined, and get some early momentum with some quick wins, and that would be how you would jumpstart a spend analytics review process.
Yeah, absolutely. I mean, I think, meetings need to be a lot shorter, and, you can do a lot of meetings, could be an email, but they need to be shorter, but what I'm, if we're going to build a 1, 2, 3, it's about getting the right data, right? Understanding where you have to get the data from, right? So you got to build that, whether that's invoice, PO, whatever it may be, and just making it easy to analyze and looking at a couple of key important metrics. But then at some point, I think there's that time, whether it's quarterly or semi-annually, where you really are just making a big commitment to look into your data.
Amen. Now, this actually brings up a question for me that's going to be pretty deep in the weeds, but I'm really curious about, when I think of invoice review and invoice line items, and thinking about data sources here, well, I'm imagining a PDF invoice, and as a data person, I'm not looking to transcribe those numbers by hand, and so I'm wondering, what do you have up your sleeve that makes it easy to translate line item invoice information into something that can be incorporated into a data model?
Yeah, I'm glad. I'm really glad you asked that question, because for supply spend, all of that comes through easily, right? Because it's either EDI or it's because it's on a PO detail and it goes out. So supplies, you can get that, right? For service spend, it's all PDFs. And so we used to, years ago, have 7 or 8 people that would have a year's worth of invoices, and they would be putting in line by line on the invoice into a spreadsheet. We literally had a department of manual data entry people. And you'll appreciate this, because even with someone just putting the data in, we would still have to clean the data, because some people would write, item as ITEM, and some would write IT. And that, you would think just write it all item, or, we'd still have data cleansing doing that. But fast forward to today, we take an off-the-shelf OCR tool, and we've customized it. We have a patent, and we take that data right off the invoice, and we're able to put it into our technology and perform analytics within minutes. And it's really exciting because we've removed all manual processes and made it fully automated on that service side.
Music to my little data heart,
Yeah.
Lisa. All right. Well, that's awesome. Ears, music to my ears, not my heart.
Yeah. Could be to your heart. That's okay.
Yeah, that too. Straight to my heart.
Yeah.
All right. The second thing I wanted to ask you about was a future innovation team. So the recommendation is create a future innovation team with your CIO's input, basically asking the question, how is our hospital going to be different in the future? And what I'm curious about here is, at least the places where I've worked and experienced, it feels like a lot of organizations might have 5 different future-focused people. They might have their strategy and planning consultants. Of course, they've got their, there's a function that'll report to the CFO. Separately, there might be a care transformation team, a value-based care team. All of those appear to be peering into the future. So how do you square all that? Or what's your recommendation when you think about that?
Yeah, that's a really interesting, perspective and nuance to what you asked. And, this whole idea of a future innovation team is really around, I'm going to say this first and then I'm going to explain it, but it's really about an environment that failure might be okay, and you're testing new technology. You're saying, well, what if we could do this? I mean, that's how we created our technology. It was, what if we could do this? And I think there needs to be a lot of that, what if we could? And starting with those really, maybe a little more far out ideas, but, looking at what technology exists, whether it's AI. I mean, you work in the predictive analytics world, which probably would more fall under now at this point a strategic plan. But, other areas like robotic processing, how do we infuse this into, okay, where in our organization could we be really innovative, or where we can drive, kind of some, make the jump from strategy to something even, so future thinking that it just takes that jump, that skip. Dan Burse is a futurist. He talks a lot about that, making that big leap over. But I just, it's allowing our minds to think really real forward thinking, and looking at opportunities or challenges, and being allowed to say, okay, we might make some mistakes. It's sometimes with strategic plans or care transformation plans, we do have a certain bit of a timeline that has to be met. There's certain things that need to be done, and this is maybe it doesn't necessarily have that specific timeline, if that makes sense,
Sure. Got it. An IT strategic plan is about how we're going to meet meaningful use, whereas a future innovation team is more about what kind of moonshots could we go after that could completely change the game. And you had mentioned what was the name of the futurist you mentioned?
Yeah, Dan Burse. He's got I'm going to go blank on his book, but I recommend everybody getting it. But he talks a lot about the hard trends and soft trends. And look up the name of the book. That'd be great, because I'm going blank for a minute. But even now he has a whole program on anticipatory and how do you anticipate the future too.
The anticipatory organization is what I'm seeing.
Yes.
Yeah, I love that. Well, it's so funny to come at this from a completely different angle. Peter Drucker, who, he's been dead for 10 years, but he said, in the 1970s, an organization has two jobs, marketing and innovation. And one thing that occurs to me about healthcare is that unlike other types of businesses, you can't just stop delivering healthcare if you feel like you need to pivot. You have to keep delivering healthcare because there are people in the hospital who are very sick and need your care, whether or not you think your care is perfect at this moment. And I think that pressure, that urgency to always be performing, can take away from the need to innovate. And even when you read in the journals like Frontiers, when you read about healthcare systems that have a pretty strong innovation function, I mean, you might be talking about 6 people in a 15,000 person organization. That feels actually like a pretty small investment in innovation from where I sit.
Yeah, I absolutely agree with you, and I love Peter Drucker as well, and it's a great point to share. And he is the the management. I don't want to say more than guru, but he's definitely legendary. And it's true. It's an organization. It's their primary function. It's marketing and innovation. And I really believe in an innovative culture, and this goes on to a different path, but not cost accounting what we started, but there's so much opportunities that lie even on the business side of innovation, right? And then you can go into care and other, but I don't think we even think about that either, as much as we should on the business side of healthcare.
Well, completely agree. And you and I are aligned in that we love to see contracts where the incentives are aligned, where we're getting paid more for doing the right thing, and that's where the innovation I'm most excited about is happening. Which, if you're listening to this podcast, I've shared that with you more than once.
Right.
All right. So the other thing that I wanted to ask you about was this sounds dangerous to me. I'm going to be frank, Lisa. A departmental incentive program to engage employees and identify hidden cost-saving ideas within departments. Now, first of all, I want to give credit because everything you hear in the lean continuous improvement mindset is about the executive's role is to align, and the frontline's role is to actually do the improvement. It's not the executive's job to figure out how to turn a bed faster or anything like that. And it would be foolish to try to have that be the executive's problem. But I have heard anecdotally that offering financial incentives for something like this can sometimes backfire. And so we all know different people respond to different incentives. And some incentives are quite tangible, like cash. Other incentives are non-monetary. So in your experience, what kind of incentives work well for what kind of departments or what kind of professionals?
Yeah, so that's another great question. And you're 100% right. Pure individual incentives on any kind of cost savings or financial improvements can lead to big problems, right? It's a careful road you have to go down. And in fact, the research states that you really probably need a lower, and that those do really, really well. So I do agree. You're 100% right. So what we're talking about, and you had it in a nuance, and it was really important because it's different in 2 different areas, right? So physicians, there's a gain sharing program, right? And so it is now it's becoming more and more a practice, whether people may agree or disagree whether it's best practice or not, but it's definitely a practice. And so I like physician alignment, and the incentive from what we always talk about is, instead of a dollar gain sharing, is more towards getting that alignment on cost savings and improvements, and then using that to buy new equipment, right? Because most physicians and most, let's say, surgeons, there's so much new technology coming out, and the hospital's got to budget that. So are there ways to align those cost savings initiatives and the improvements and say, okay, we hit this $1 million, we can go get you that robot or a second robot, but to me, that makes perfect sense. I love that. I think that's just a brilliant way to engage the physicians in wanting those newer, new pieces of technology and getting them involved into that process. And that works really, really well. I've seen that work well. So as it relates to, departments, there's just a couple of ways to handle that. I think you give them a department goal, and it could be anything from, now, of course, life is so different, we can't all go out to dinner, I guess. But there's ways to give a group an incentive, and maybe, a virtual dinner. I don't know what we do now, but but I think as a team goals and maybe some small financial goals, but it's got to be done in a team way so people aren't competing, and that could be very, very problematic. But to, maybe some time off. People, value, time off. Time off is currency, right? Time with your family or things, like that, or, certainly there are those gift programs. But for me, I also like time off. I like bonus days. I like, things that you engage the group together, and that it aligns the goals. So that's how we see, or I see, those incentive programs. Adam, does that help you feel a little bit better about what we were talking about? Or
No, it does. And of course, I teed that one up for you because I was sure you had done this thought exercise before.
Yeah.
But I was really curious, and I like the direction that you're going. That this needs to be a team incentive, not an individual incentive. It actually, when I first read this, it reminded me of a Dilbert comic strip from many years ago when they were going to start getting paid $10 for every bug they fix in the code.
Yeah, right. I found a lot of bugs.
I'm going to write myself a new minivan this afternoon.
Exactly. Yeah, no, we're not looking to do that at all. Yeah. It should be a fun way to, get everyone aligned. We worked with, we've done this a couple of times. We haven't done it recently, where we have this, big, whether it's a thermometer or some kind of goal that the hospital is looking at, and it's visible in different places, and they could see, what's being accomplished. And, hospitals do that in different ways in their workrooms. But this was real big, where it was the organization, and you could really see that needle going up. And that's fun too, right? People, they want to get around a purpose and a mission. And I really believe in this culture of cost consciousness, and how do you really get them behind the mission? And, it's a good way to get everybody involved.
Absolutely. And I appreciate that this is where that's where you'll leave it, because, as I thought about how to prepare for this conversation, from the perspective where I sit, working with a lot of primary care providers and in PO contracts, thinking about hospitals lowering their costs, I can just picture one of my favorite physicians to work with. I could just picture him saying, in a private setting, yeah, they better lower their costs because reimbursement isn't going up anytime soon.
Yeah.
Right. And so I like the direction you're headed. Cost conscious. I think I'm going to adopt your East Coast accent if I'm not careful here.
Sorry.
No
terrible.
Apology requested. But the cost conscious idea, I think, is really important, because we're talking about a country that spends 18% or 18 cents out of every dollar on healthcare and doesn't get a lot of health in exchange for that money. I think we can all do our part to improve that.
Absolutely. And I just think that you want people to be thinking about, more active thinking, right, about costs, and that's what we support, right? It's we look at pricing, we look at utilization, we look at contracts. There's so many different aspects of it. But can you look at something, and Adam, you do this more so probably even than we do, but you're thinking about models, you're thinking about how this analysis is going and how we can make improvements. But what we're saying is that it's got to be everybody, no matter what, thinking about this decision, or can we do this better? Can we save here? Wait a minute. There's a man's comb in the kit on the children's floor to brush their hair. Like, maybe that man's comb in the kids' kit for the med surg shouldn't be in there. I walk around, or more so not in this past years, but thinking, wait a minute, that doesn't make sense. That, and I'm not trying to pick apart anything. I look at it from, I want to save money. Like, oh my goodness.
Well, and when you can save money, and that is such a perfect example, because a men's comb in a pediatrics kit, it's also an incongruous brand experience. So no marketing person would ever sign off on something like that either.
That's right. That's a good point. What I would like to see hospitals do, and I know that they are talking about cost, but it would be more from a unifying, message, and getting more into, these things and these details. So but that's now on my soapbox versus my cost accounting hat. So, but I think it all matters. So.
Great. I'd like you to get up on your soapbox one last time, Lisa, if you don't mind. So first, I'll remind the people listening, we can find you at viehealthcare.com, and I should spell that VIE healthcare.com. Lisa is also on LinkedIn. Lisa, I really appreciate your joining me for the podcast, and I'm just wondering what kind of parting thoughts or parting suggestions would you have for a person listening to this, or who wants to take your ideas and make them maybe more concrete in their organization?
Yeah, it's great. I think, I'll do a strategic and a tactile one. I think from a strategy perspective, as we go into 2021, and now we have, now we have to be concerned also about the transparency and pricing, and we've got more of these squeezes in margin. And I know cost isn't always very, sexy, or the cost side. We all love to grow, and growth is super important. I understand it, and we've got to be innovative. I love innovation, but I think there's something to be said about adding this very unique, deeper view of cost into the hospital strategy. I just think there has to be, and yes, it's not the most probably glamorous, but I think it's going to yield a lot, which could make then other endeavors more glamorous. And I think the tactical area is probably around what you and I love. It's so much is in the data. You really have to make a really big commitment to the data side. It's just so important. That's where you're gonna unearth all these opportunities. So those are my two parting thoughts.
Perfect. Oh, we are in alignment, Lisa. Again, thank you so much for joining me. And to everybody else, thank you for listening. Howdy, healthcare people. It's Adam again. Are you hiring an analyst or a data scientist? Would you like to make sure you're attracting the best candidates you can? If I were advising you, I would suggest you take an extremely close look at your job description. The job description is a huge chance for you to stand out, and most people, frankly, completely miss that chance. You'd actually not believe how many job descriptions I've read and then read them again and still had no idea what the job was really about. Top candidates, they're just going to stop reading. They have better things to do than try to sift through that stuff. But actually, it's not that hard to write a job description that the best candidates will actually be excited about. There's a formula. And whenever I show someone a job description written with this formula, they always say the same thing. Oh, that's much better. So if you want the formula, I made a quick guide on how to do it with some actual examples thrown in. It's free, and you can get it at analyticaliq.com/JDT. That's analyticaliq.com/JDT for job description templates. All right, good luck out there. Thanks.